Hi, I'm Vernon. I have autism spectrum disorder. It is also called ASD or simply autism. I am here to share what I know of this disorder so that you will understand us better. What is autism? Autism is a developmental brain disorder. It affects our social, behavioral, and communication skills. What is autism? We do not automatically develop social, behavioral, and communication skills like neurotypical people do. Neurotypical people are those without learning disability, like most of you out there. People who have autism start showing signs at an early age, like I did. One person with autism is different from another person with autism, just like one neurotypical person is different from another. This is because each one has a personality that is uniquely his own, and the degree of autism varies from person to person. Doctors often refer to autism as autism spectrum disorder because of the wide range of symptoms and severity. Some of us are low functioning or have severe autism, while others are considered high functioning or have mild autism. People who are considered low functioning or have severe autism have much greater difficulty developing social behavior and communication skills. Most of them never learn to speak. It must be so frustrating, stressful, and frightening for them not to be able to express how they feel. People who are considered high functioning or have mild autism can develop some social, behavioral, and communication skills. Some of us can even finish college or even higher education, but we shall always have our quirks. It takes us a longer time to learn the skills that neurotypicals our age have already acquired. Autism is not a disease, it is not contagious, it is not synonymous to mental retardation or lack of intelligence. Some of us are highly intelligent, even geniuses. What are the symptoms of autism? We have a whole range of symptoms. Some of us have more than others. Some of us have mild symptoms, while others have severe. Here are some symptoms of autism: avoiding physical touch or eye contact, not responding to voices or other sounds like when someone is calling their name, not talking, not understanding hand gestures or body language, rocking back and forth, spinning or banging their head, stare at part of an object such as the wheels of a toy car, fixate on certain topics or things like Power Rangers or Kamen Rider, not pretending or playing make-believe games, being concerned with order, routine, or ritual, and becoming upset if it is disturbed or changed because personally it can be stressful, having a flat facial expression and or using a monotone voice, being unafraid of danger and accidentally causing injuries. Actually, when I was young, I was mostly unaware, not afraid of the presence of danger. About 20% of children with autism develop normally during the first 1 to 2 years of their lives. Then they regress or lose skills that they already had before, such as the ability to talk. On the other hand, some of these children gain special skills like the ability to do complex math problems in their heads. These are less common. What causes autism? Doctors are not sure what causes autism. Some studies suggest genetics, certain health problems, things in the child's environment, etc. In most cases, the cause of a child's autism is never known. My dad said I have it because I am handsome. Vaccines do not cause autism. Vaccines are important because they protect not just the children but all of us. How is autism diagnosed? There is no lab test that can detect autism. Talk to your doctor if your child does not behave as expected for his age. If a doctor suspects autism, he may refer your child to a specialist. In my case, I was referred to a developmental pediatrician. Can autism be prevented or avoided? No. Based on latest studies, autism cannot be prevented. Autism treatment. I'm already an adult, but I still have autism because children do not outgrow autism. Currently, there is no cure and no one-size-fits-all treatment. Medicine alone cannot treat autism, but it can help manage some symptoms like sleeplessness. Some children benefit from intense behavior and speech therapy. I had both along with social skills and work skills classes for a total of 15 years. People with autism, myself included, see and react to certain things in different ways. You have a harder time paying attention. You have a harder time studying. My parents found other ways to teach and connect with me. They have been working with my doctors to continuously improve my life. They create routines and habits so I would feel safe and relaxed. How do you communicate with people with autism? Speak slowly and clearly and don't expect an immediate response. People with autism, including me, need more time to process what you tell us and what we should reply. Keep your communication simple. Make your sentences short. Use less words. Give simple and straight to the point instructions. Do not use sarcasm, figures of speech, idiomatic expressions, or reading between the lines. We think things very literally. Be gentle, persistent, and patient. Don't rush us. Don't force eye contact or touch. Encourage special interests, but teach give and take in conversation. Pay attention to nonverbal signals. Certain actions we use while speaking might tell you more than the words we say. For us with flat facial expression, please pay more attention to what we say. Having a friend with autism is priceless. He or she can be the most honest person you will ever meet. Thanks for watching. Until next time. Bye.